Hello and welcome. I'm Steve Clemons, editor-at-large of The Hill. Thanks so much for joining us for our program today. It's called Strengthening America's Healthcare System. So we all need to strengthen America's healthcare system, but there's a lot of different views on how to do it. Over the next hour, we're going to examine the current state of American healthcare and ask how it can be improved for all patients with an eye to the future. Before we begin, I'd like to thank our sponsor, the Partnership for America's Healthcare Future, for supporting today's conversations. More than a decade after the passage of the Affordable Care Act, a record number of Americans have access to healthcare coverage, but millions still remain uninsured. Today's program will look for answers to crucial questions like how can all Americans have access to quality, affordable care? How can stakeholders from across the healthcare ecosystem begin to collaborate to strengthen the Affordable Care Act and improve patient health? And what role can policymakers play in addressing issues like coverage, cost, and barriers to access? Before we hear from our fantastic speakers, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillHealth. The hashtag is way more important. We're broadcasting live and we'll be taking your questions throughout the program. And I always say this, as with any live stream, if it goes wonky on you, don't throw your computer out the window. Just refresh the page and hopefully it will fix the problem. My first guest is Congressman Brad Wenstrup from Ohio. He's a great friend of The Hill. Often talk to him about big healthcare issues. Brad has been a physician himself for more than 30 years. He's co-chair of the GOP Doctors Caucus. Congressman Wenstrup, it's great to be with you again. Look, I want to just ask you point blank. We've discussed healthcare, you and I, so many times. And I have been reading something you've been saying, we need to stop talking about lifespan and think about health span. And I'm interested in what that Wenstrupian comment means.
Well, I'm glad you went to that first, because I think I would have tried to go to that as the overarching theme, right? And then we start getting into the details of healthcare. You know, so what do we want success to look like in America as far as health? We want our citizens to be healthy. That is probably the most important thing. So how do we go about doing that? You know, we can get into all the details. We need providers, we need this, we need that, we need access, we need transportation to the doctor, to the hospital, whatever the case may be. But health span versus lifespan. And actually in America, we do pretty well when it comes to lifespan. If you think about it, outside of, unfortunately, suicides and drug overdoses, we can keep people alive for a pretty long time. So I always want to talk about health span. How do we maintain people, even people with chronic diseases? How do we keep them healthier longer? I always sort of tongue-in-cheek point out that none of us are getting out of here alive. So how can we keep us healthy as long as we possibly can? And for those that want to be talking about the cost of healthcare, that's really where the savings is, because the more you can keep people healthy, the better off that we can be. So I look a lot at preventive care, preemption on things, early diagnosis, those types of things, along with innovations and cures. And then, of course, having it affordable. So, you know, for all Americans, we want access to quality care, access to the treatments that are available, and we want the development of new treatments. And in that vein, keep people as healthy as we possibly can. I know you and I have talked about in the past, even down to the grade school level. Are we really doing the best job that we can on health with kids? Are they growing up really knowing what are the best foods to eat, what is best for them, and why they should be eating certain things and exercise, all those types of things we really need to take a look at. But it's about keeping people healthier longer, and how do we go about doing that?
Well, you know, I think one of the things you're talking about is so important, Congressman, which is, you know, people having a relationship with their doctor, with the healthcare system that's ongoing. And, you know, I often criticize, I mean, you and I have talked a lot about government, foreign policy, and my criticisms of government is when that government is defined by being reactive all the time to incidents that happen, as opposed to being strategic. I think that probably, you know, and I know you think of this, it also applies to healthcare. Like, how do we be strategic about, you know, what do we do to, you know, deal with obesity in this country in a real way? What do we do to look at some of the chronic conditions, as you said, as opposed to just reacting at that moment when someone's health begins to quickly deteriorate? Do I have that right? Is that and how many of your colleagues are willing to begin thinking about health span as the model, as opposed to a reactionary model in health?
Well, you know, I think that it's kind of been the same old, same old. We've been a system of break it, fix it, break it, fix it. And I think people are starting to catch on more and more. I can tell you the doctors are. You mentioned that I'm one of the chairs of the GOP Doctors Caucus, but we are often in conjunction with the doctors from the Democrat side. I've got bills that we passed and some that we have in the works that are very bipartisan, and surprise billing was one of those. So we need to drive along in that direction, and we do get that done. But outside of healthcare providers in Congress, a lot of that is lost on them because sometimes it's like, well, I don't really understand what you're talking about. So we need to educate everybody on what is taking place in the healthcare arena. And you're right about government. Oh, there's a problem. Okay, let's fix it real quick. Well, let's try and not have to fix it. So one of the analogies I like to use, Steve, is, we give a lot of credit to the cardiothoracic surgeon that cuts you open and saves your life after your heart attack and gets rid of the blockage, and you live again. And that's a wonderful thing. But we don't give enough credence to the doctor that prevented you from ever needing that procedure because we kept your heart healthy and you did all the right things and you took the right medications and got your periodic checks. So think about this as we go forward. A lot of people, they budget with their health care. And so they may have insurance and may be considered to be really good insurance with access to a lot of great providers. But there are times when they say, you know what, well, I'm not going to go to the doctor. Why? Because, well, I have a high deductible, or I have this copay, and I really can't afford that this month, or whatever. Well, what if you got one well visit a year with your primary care doctor where you didn't have to pay a copay or go towards your deductible? Why? Because you want to be ahead of things. Or if you have a chronic disease such as diabetes, or there's so many of them out there where you need to be seen by your doctor on a regular basis. Okay, well, maybe to incentivize you to make sure that you go to the doctor and stay as healthy as you can, that you reduce that copay, or there is no copay, because it's far more of a greater savings, if you will, if you go to the doctor and you keep things under control rather than not going. Things get out of control. Now you're in the hospital. Now you're sicker. So we got to start thinking about some of those things where we're really striving and stress the importance of keeping people as healthy as we can.
Brad, let me ask you a question about the social contract around health. Now, I should address you as Colonel Wenstrup because I want to tell our audience that you're a colonel in the military reserve, in the Army Reserve. You served in Iraq. You won decorations for that, and you're very intimately, and you had a private practice for many years. So you know the doctor side of this, and you also have a connection to patients. And I'm just sort of interested as we kind of look at that. What are we missing in this conversation when we get down to that patient level? And they see today in today's world, vaccine mandates. They see, questions about how much is out of pocket for them. They hear about PA. It's a confusing health, turbulence out there for people. What is broken for that patient that we have to begin to get better than we've been doing? What is your suggestion to the Biden administration on how they lead in this and how they fix some of this?
Yeah, and it's not just the Biden administration, really it's us in Congress as we work together. I mean, it's not always seen what happens with patients. I have a patient that I had to see on a regular basis. He's diabetic, and he often had breakdowns and ulcers on his feet and things like that. We always wanted to be a step ahead of the game. I need to see you regularly. And then one time he said to me, I'm not going to be able to see you anymore because the bus that I take, it doesn't come here at the right time and allow me to get here and then to dialysis. So, and I'm thinking, I said, no, that's not going to work. What time do I need to be here to take care of you? And so we made that adjustment, right? So there's a lot of things that just have to be addressed, but they're almost a one-on-one. But we're starting to see things. Let me just use that example, the diabetic with end-stage renal disease. If we can have a one-stop shop, okay, where you can go and all those caregivers are in the same facility at the same time, that's a tremendous thing. And so, and we start looking at outcomes, okay? So, and we're seeing some of that, right? Where, your reimbursement or whatever is going to be based on what kind of outcomes that you have. And I think it's important that we continue to drive in that direction. Scientifically, Steve, there are so many things that we are doing now to monitor patients, say around the time of surgery. You can go home with a pulse oximeter oximeter, and we can know if you're getting any respiratory problems after anesthesia. And we can know right away, so we nip that problem in the bud rather than, hey, I'll see you back in the office in 2 weeks. We're doing more outpatient type of surgery, so that's good. But let's not lose track of monitoring the patient every step of the way. So a lot of things are going in the right direction. We get stymied a lot of times on prior authorization, things like that delays care. You see the patient, you're the doctor who saw the patient, you recommend a treatment, and now you have to go through hoops with the insurance company and talk to people that never saw the patients and sometimes aren't even physicians. And that's very frustrating. It's a delay in care for patients. And so we have a bill out there, Seniors Timely Access to Care, that addresses that. And then, things like with what you prescribe, and the insurance company says, no, we want you to use this other drug first. And you're like saying to them, but that's a contraindication. You don't know this patient has this other medicine they're taking. I mean, it gets very timely, and there's so much reporting that we have to do. It gets more and more tired. I would say on a bipartisan basis, of the doctors in Congress, we met with the Surgeon General yesterday. The first thing he wanted to talk about was clinician burnout. And so we really have to make the job more enjoyable for physicians again, because they're going to start retiring. And now we've got issues coming up right now on our plate where Medicare reimbursement is about to drop for providers. And there's only so much you can drop, and there's only so much volume you can increase. And so it's getting tougher and tougher. And we got to make sure that we have providers out there too. That cannot be assumed. And so those are some of the things that are on our plate. And it all comes down to patient care. Yeah. And that's really who we're here to advocate for, is to be able to take care of our patients. We want to be able to reestablish the joy of taking care of patients.
Well, your comments about, doctors and clinicians falling out of the system, retiring, stepping out, saying we've had enough. I mean, I read about it all over the country, all over the time, in Florida and Oklahoma and California. I mean, you see it everywhere. You have characterized President Biden's Build Back Better plan as the Build Back Broke plan. And I'm interested in, you said it's mostly pain and no gain. If you were to get in and tinker and move elements of that plan around, particularly the health provisions that are in there, how do we get I always kind of frame things, how do we get gravity moving in the right direction from your perspective? Now, a lot of people are arguing about, which direction we could go, but I'm just sort of interested, what creates mutual reinforcing, cascading positives in American healthcare versus what I think you've been saying is, hey, this is the wrong track, this creates more negatives than positives?
Well, I think one of the things you can look at right away is with the price of drugs, and what's in that plan that is absolutely going to drive innovation out. And what people have to realize, when a new drug or a new cure is out there, it comes with years of research and a large portfolio of ideas that finally come down to one that may get through the FDA and get approved and save lives and this and that. So if we're making it so difficult for new drugs to be manufactured and innovated, they're going to leave. And we want those to be made here in the United States, and we want the innovation to continue here in the United States. And that bill, as written, is going to drive people out of the United States and stymie innovation. And they all will tell you that. I know there's the fine line. It's easy politically to say, well, these pharmaceutical companies make big money. Well, they also put big money down and take a lot of risk, and sometimes they don't make it. So there's that. How do we thread that needle? But the drug bill that's in there right now is just going to tax them to death, and they're going to leave. And also, as we look at what we're talking about now, is when we had the Tax Cuts and Jobs Act, yes, we did reduce taxes, and it wasn't just for the top 1%. It was across the board. And you had no inversions. You study business enough where you sit, Steve. You get it. You want American companies, but we had no inversions since that went in. And revenue to the government went up by cutting taxes because more people were employed than ever before. Businesses were growing. You talked to some of the pharmaceutical companies during that. They were expanding and increasing their workforce and working on new developments and new drugs. This will do just the opposite. And to me, that is pain without gain. And so we shouldn't just be demonizing so many entities of the healthcare arena Well, I'll give you an example. See, when I first started in practice, here I am, $200,000 in debt, and all I kept hearing as I picked up the paper every day, and this is in the late 80s, is greedy doctors this, greedy doctors that. And I'm like, excuse me, I'm $200,000 in debt. And I'm not making that much because I'm starting with a small practice with 2 employees, and if someone's sick, my mom comes in. And so, and I also want to have the opportunity for that type of medicine to be there as well. I represent a lot of rural America, and they need the old country doc that can take care of you on a regular basis. And the way we are evolving now, it's much more difficult because of so many regulatory burdens that a solo practitioner or a 2-doctor practice cannot afford. And so they end up quitting or going to the cities. And so we got to think about all of America when we think about our healthcare environment.
Well, listen, folks, a lot of people know our guest is Congressman Brad Wenstrup. Others know him as Colonel Brad Wenstrup, but today he's Dr. Brad Wenstrup. Thank you so much for your realism and your candor, Representative, and thanks so much for joining us as always.
Good to work with you on these issues, Steve. I appreciate that. There's a lot to do and a lot we can do. Thanks.